Hi everyone, it's Dr. Patel from Lake Nona Ophthalmology. I'm going to talk a little bit about what a cataract is, what are some treatment options, and what are some lens options that go along with it. A lot of people wonder what a cataract is. A cataract is really when the natural lens of the eye becomes cloudy and hazy over time. I joke with patients all the time, it's like gray hair. If you don't have it now, you're going to get it at some point. Almost everyone will develop a cataract in their lifetime. Just to show you an example, this is the model of the normal eye. So when light focuses from outside the eye to inside the eye, it goes through two places. Light focuses first through the front of the eye, and that's called the cornea. And then it goes through the lens of the eye, which sits right behind the pupil and is the natural lens of the eye. When we're young and healthy, the lens of the eye is completely clear. As we get older, as a result of the natural aging process, sometimes patients are on medications, and certain medications can accelerate the formation of a cataract, like prednisone or other types of steroids, even other types of medications. Sometimes patients that are diabetic and have uncontrolled sugars can actually accelerate the formation of a cataract. As you can see, when patients are young and healthy, this clear lens can become a cataract like this. This lens becomes milky or cloudy, and light has a much more difficult time focusing into the eye. Cataract surgery is the treatment for a cataract, and it involves removing the natural lens of the eye. The natural lens, which we showed here, which is what became a cataract, sits right behind the pupil. And what we do with cataract surgery, and this is a very simple example, is we remove the natural lens of the eye that's become cloudy and hazy, and we actually are implanting a new lens implant in the same place. That lens implant will stay there for the rest of a patient's life, and it'll allow light to focus naturally again onto the back of the eye. In my opinion, we have a dynamic discussion between myself and the patient to make sure that the time is right to proceed to cataract surgery. There are a lot of options that come with cataract surgery, and cataract surgery has advanced tremendously over the last 10 to 15 years, especially in terms of technology. What I tell patients is that there is no bad choice when it comes to cataract surgery. Whether a patient does basic cataract surgery or whether they get cataract surgery with all the bells and whistles, patients are going to see really, really well. It just depends on how much or how little a patient wants to be dependent on glasses, and that's a totally personal decision. When it comes to the lens implants, there are basically three different types. We can correct distance using a monofocal lens. The other lens option is an astigmatism lens or a toric lens. A toric lens corrects the astigmatism and a distance, such as distance or up close. But when we implant it into the eyes, we actually rotate the lens along the axis of the astigmatism to make sure that it is corrected appropriately. The last type of lens is a multifocal lens. And there are a variety of multifocal lenses that are available now. It allows light to focus at multiple distances and allows patients to be able to see multiple things from far to up close and in between. In my opinion, the best lens choice for the patient depends on the specific measurements we take and the activities and hobbies that a patient likes to do. There isn't a one-size-fits-all. I really believe in a customized and individualized approach to cataract surgery.